maybe only cut functional, maybe only stub functional, maybe mixed cut and stubbing functional, chopped functional, firearm. Firearm can be few types too, as battle, hunting, sports, special, rifle, smooth, with small caliber, large caliber, medium caliber. These are all material evidence. I repeat, material evidence can be as a biological region and a non-biological region. Final objects. These are materials of civil, criminal cases, and my dear doctors, attention please, medical documents. In difficult cases with medical mistake, medical documents, these materials, objects of forensic medical examination, if take Ukraine. So next, my dear friends, repeat, objects, living persons, dead bodies, material evidence, and materials of civil criminal cases and medical documents. Next, types of forensic medical examination. Who is it forensic medical expert, my dear friends? In Ukraine, this person with the rank of doctor, who has received special training and holds and established post of forensic medical expert in Bureau of Forensic Medical Examination. Now I work as a teacher of forensic medicine, theory, practice. If I work in Bureau, I will forensic medical expert name, forensic medical expert. Sorry, my dear friends, continue. Structure of Bureau of Forensic Medical Examination. So remember, in forensic medical examination, distinguish four objects, yes? This living person, this corpse, this material evidence, and the material civil criminal cases and medical documents. And look on this slide, I give you structure of Bureau. First department. If in most cases victim continue to live, first department is examination of living persons. Next, department of examination of dead bodies. Next, department of commission examination. This department work with documents, with material civil criminal cases and the medical documents. Department of examination of material evidence. And my dear friends, look, in our laboratory present histological research, cytological research, immunological, toxicological, we will remember pharmacology and the chemistry, biochemistry, and topic toxicology, and the medical criminalistic examination. And as in hospital in Europe, present department of the duty forensic medical experts, and the final, as a head department, organizational and the methodical department. So structure: department examination of living persons, department examination of dead bodies, department commission examination, department examination of material evidence, duty forensic medical experts, and organizational and methodical departments. So, my dear friends, now I have in Zoom program only 3 minutes. As a result, please all together, 1 minute now I open presentation in Zoom program. Primary forensic medical examination. Primary. Why this type name primary? Because, look, primary or initial forensic medical examination is the first examination of object. Different objects of forensic medical examination: living persons, dead body, material evidence, and the other objects. After its result is formed, the forensic medical expert is formed a document with name conclusion of expert. In this document present main full information with answer, full answer on the question which I give policeman for forensic medical examination. So first type, primary forensic medical examination. as the name initial forensic medical examination. And look, my dear friends, next type, secondary forensic medical examination, is carried out in cases in complete primary examination. And for this definition, secondary forensic medical examination, main information, I write this information green color. This investigation is carried out by an primary expert and maybe other expert. As a primary, if primary expert is busy, this investigation is carried out as an expert. Why this information main for this definition, secondary forensic medical examination? Because in forensic medicine, distinguish a next type of forensic medical examination, repeated forensic medical examination. This examination can be appointed in the cases when conclusion of expert is doubtful, disagrees with the results of preliminary investigation, or is groundless. And my dear friends, look, this examination, if policemen think conclusion of expert is not true, this examination is carried out only as expert, my dear friends. If take secondary, in this situation, look, investigation is carried out by a primary expert or other expert. In case with a repeated forensic medical examination, this examination is carried out only as an expert, Next, commission forensic medical examination can be appointed in the difficult criminal cases with the participation of several specialists in medicine. In this commission present may specialize this forensic medical expert and the other specialists in medicine. As a result, this examination named commission forensic medical examination. Next, complex forensic medical examination is carried out with the participation of experts of different branches of knowledge. In this situation, in commission, present as a forensic medical expert, may be present doctors, and look, present as different specialists, as maybe military, maybe techniques, maybe chemistry, maybe physics, and other specialists. As a result, this type named complex forensic medical examination. Next, my dear friends, forensic medical documents. Remember, I said you in last slide, next information, main document for policemen and for forensic medical expert. This report of forensic medical research or forensic medical examination, as a name, conclusion of expert. In this document, distinguish three parts. First, prologue, next, research, and the diagnosis and the conclusions. So, my dear friends, a diagnosis, forensic medical expert is formed in case with autopsy, in case of investigation or examination dead bodies. In other situation, expert write only conclusions without diagnosis. Now, so if our topic is thanatology, now I give you structure of forensic medical diagnosis. And my dear friends, remember clinical diagnosis, structure of clinical diagnosis, which are present into history of disease. Look, in this diagnosis, distinguish three parts: basic disease, complications, and accompanying changes. So if take basic disease or injury, basic disease with the list of the attribute confirming the given diagnosis. This basic disease may be this acute disease as acute ischemic heart disease, maybe chronic chronic in a stage, acute stage, maybe chronic ischemic heart disease, if present chronic cardiac insufficiency as a cause of death. So basic disease, first part, basic disease. Next, complications of basic disease, result, outcomes, and the accompanying changes. My dear friends, accompanying changes, this disease and its complication which not pertain with cause of death. Remember, pathomorphology in most cases, cause of death is complications. So next, medical death certificate, as in Ukraine, as in your country and other countries, formed as a forensic medical expert and the doctors, different doctors. No, in most cases, it's family doctors. If a patient is died due to chronic pathology, chronic difficult pathology with long period. So look, in this document present two parts, first part and the second part. In first part present the subparts A, B, and C. A, main cause of death. B, complications. C, basic injury or disease. Change place, да, меняем места, as in diagnosis. First, basic disease. Next, complications and accompanying changes. If take medical death certificate, first part, A, main cause of death, B, complications, C, basic injury or disease. So next, my dear friends, look, you can see form of medical death certificate. This form present as in Ukraine, as in your country. Look, A, B, and C. A, B, and C. Now take next slide. I show with situational task. Situation. I take a traffic accident with squeezing body between anterior surface of a bus and the wall. Squeezing body between two blunt objects with flat prevailing surface. The autopsy revealed deformation of the chest, multiple fracture of the ribs, indirect fracture with trauma of the lung tissue with pulmonary bleeding, and trauma, with hemothorax and anemia. In the abdominal part of aorta present signs of atherosclerosis. So if take diagnosis, basic injury, my dear friends, look, closed blunt trauma of the thorax due to clench. Complications, multiple fracture of the ribs, injury of lung tissue, pulmonary bleeding, hemothorax, and look, final difficult complication, acute post-hemorrhagic anemia of inner organs. Accompanying changes, atherosclerosis of aorta. Medical death certificate, A, acute post-hemorrhagic anemia of inner organs, pulmonary bleeding, hemothorax, injuries of lung tissue, and multiple fracture of the ribs, and closed blunt trauma of the thorax due to clench. And in second part, rewrite accompanying changes, atherosclerosis of aorta, So, my dear friends, I repeat, if take diagnosis, basic closed blunt trauma, in medical death certificate, first part, the C, closed blunt trauma, because this cause of complications, and the complications cause of death, reason of death, because in our situation is formed a difficult complication, final complication, acute post-hemorrhagic anemia of inner organs. So, my dear friends, this final information in first topic. Now, my dear